Welcome to today's program. There is more to VDI than meets the eye. The tools and trends for faster access, more mobility, and security of data in a healthcare environment. Sponsored by Siemens. I'm Charlene Marietti, Director of Editorial Initiatives with Healthcare Informatics. Before we begin the program, we have a few housekeeping details. Today's program is interactive. Each window displayed on your program console is adjustable and can be enlarged or downsized to suit your preference. You can also move these windows around the console. Just click and drag. At the end of the bottom of the console, you will see several widgets you can use to participate in today's program. Feel free to click on any of the widgets at any time during the program. They will not impact the performance of the webinar player. To download a copy of today's presentation, please click on the green Resources widget. If you have a question for our speakers, please click on the red Q&A widget to submit a question at any time during the program. Our speakers will answer questions from the audience immediately following the presentation. We also invite you and our audience to share your thoughts. Share about today's presentation via the Twitter widget, which can be accessed by clicking on the blue Twitter icon at the bottom of your screen. Simply click the Post and Authorize buttons to log into your Twitter account and begin sharing. At this time, it is my pleasure to introduce today's speaker, Jim Kaler, Nick Volleson, Andrew Frazier, and Craig Doyle. Jim is the director for a number of value-add technology service lines, including Saurian Information Access, Single Sign-On, Security and Privacy, Self-Service, Desktop and Server Virtualization, Networking, and Storage. Jim has more than 25 years of healthcare and technology experience in consulting, management, and business development services. Nick Volleson is the Saurian Information Access Survey Lead for Healthcare Professional Services, which provide VDI, SBC, SSO, and UEM design and implementation services. These services enhance clinical information workflow while they improve security and compliance. Nick has more than 20 years of experience in healthcare information systems and extensive experience in designing, implementing, installing, and maintaining systems and networks in a mission-critical environment with technical certifications from VMware, Citrix, Imprivata, Appsense, and Cisco. Andrew Frazier is the Security and Privacy Service Lead for Healthcare Professional Services and leads a team of security professionals providing value-add services, including risk assessments, information security operations, and technology safeguard implementations for healthcare organizations. His previous roles include C-level technology leadership positions in private banking and venture enterprises, and lead security architecture roles in organizations such as Ally Bank, General Motors, and Covasant. Andrew served as a member of the U.S. Navy and studied computer science and forensics at Lawrence Technological University in Michigan as an undergraduate. Also joining us during the presentation will be our special guest speaker, Craig Doyle. Craig is CIO at St. Tammany Parish Hospital in Louisiana. Craig will be discussing the details of his hospital's VDI implementation and provide perspective on the project as a whole. Thank you to our panel for joining us today, and with that, Jim, the audience is yours.
Thank you, Charlene, for that wonderful introduction. I hope everybody's having a fantastic day wherever you might be. So we'll just start off with a quick review of the agenda. So we'll start off with a discussion of key components of a fast, easy, mobile, and secure solution. Then we'll jump into reviewing the system integration requirements for these types of solutions, understanding the security impacts related to mobile devices and desktop virtualization. Craig's going to provide us with customer experience and feedback, and then we'll conclude the presentation with questions and answers. So let's jump right in. By first understanding the presentation title, there's more to VDI than meets the eye. As we know, we've all been in the space for some time. Virtual desktop infrastructure has been around for a number of years, and it's provided a great deal of value and continues to spark a great deal of interest. But VDI by itself is not a total solution, especially in healthcare. We believe that in order to provide that fast access, more mobility, and security of data for end users, there are some key components and tools that must be considered. Those components, and I've listed them here, and we'll provide more details, include single sign-on, authentication management, user virtualization and personalization, context and location awareness, mobility, security, and I missed one there, performance monitoring. And then wrapping it all together is a proven methodology that consists of assess, design, deploy, and maintain. At this time, I'm going to turn the presentation over to Nick Volosin, and Nick's going to take us into more depth into the key components and tools. Nick?
Thanks, Jim. Most of us know that VDI is running a virtual operating system on a virtual machine that's running in a hosted server in a data center. While the concept of running a remote Windows desktop has been around for about 20 years, the maturity of products and tools to manage it have become mainstream in the last 2 years. As Jim mentioned, we're going to spend a little bit of time talking about using VDI as an enabler in healthcare to achieve a more secure, fast, and easy access to clinical information. While VDI still remains a buzzword in the IT industry, there have been many marketing-driven blogs calling each year the year of VDI. To have a successful implementation, you have to have a reason for doing VDI besides just that it's cool. When we look at the issues with traditional full PC clients in healthcare, we come across issues like long login times, too many user names and passwords, cluttered desktops trying to accommodate all the applications that may be run by multiple users, clinicians leaving applications containing PHI logged in and running when leaving a workstation, the lack of a mobility solution or a consistent remote access solution, but basically an inconsistent user experience on different workstations. There are many vendors selling VDI products, and all have similarities. They have a hypervisor running on a server host, management tools to determine server and virtual machine performance, mechanisms to clone and provision VMs to expand the number of concurrent connections, processes to assign users to those virtual machines, and various clients for different types of devices to connect to the virtual desktops. But when you get into the weeds, each have their unique strengths and weaknesses. We find that with proper tuning and following best practices, performance and user experience is very similar. The established vendor relationships and existing skill sets within the IT department play the most significant role in choosing a vendor. But when there's not a clear choice, we have many clients that do a bake-off as part of their proof of concept. Many will tout that VDI can solve all the problems that are inherent with traditional PC deployments. While VDI is the enabling technology and helps streamline IT processes, VDI by itself does not improve or simplify the amount of steps needed to access the clinical information systems. Authentication management and single sign-on technologies have also been around for many years and now are important integral part of improving clinician workflow. When implementing authentication management, you want one that's flexible and can adapt to various security policies such as proximity cards that may already be in use for facility building access, PINs, fingerprint readers, or a combination of those technologies when necessary. One feature that is valuable in healthcare is to enable a secondary authentication inside of an existing application. For example, to enforce a PIN entry when entering a medication order. Single sign-on is a huge user experience satisfier and typically creates excitement and buy-in from the stakeholders. Implementing single sign-on inside of VDI simplifies the rollout of the technology, as you are able to provide a consistent desktop with the same browser, Java, and other third-party components, and the user is logged into the desktop with their own Active Directory identity. The combination of authentication management with VDI enables the tap-and-go roaming experience. For example, in the diagram below, the user logs in the first time and enters the required credentials to gain access to their desktop. They're connected, their applications can auto-launch, and are signed in with their stored credentials. The user then can tap their proximity badge, their employee badge, on the reader, and it will disconnect them from that workstation. And then they walk over to another workstation, tap their badge, and they're right where they left off. And then even if they forget to tap out and they walk to another workstation, they can tap in, and that session is disconnected from where they were, and it brings it right to their new device. The important thing is,
Nick, before you leave this slide, could you talk a little bit more about the tap and go and what provides that functionality, and what do we see when we've implemented this, the response times and representation of the screens?
Yeah, typically, depending on the device in use, they can range anywhere from 3 seconds to 7 seconds. There are technologies out there like Zero clients that have a little OS footprint, small OS footprint, or actually hardly any. They just run on firmware that provides almost immediate access when using a proximity card reader back to your virtual desktop. So there is an initial login time, just like with typical Windows workstations. So there are methods and tools to improve that time. But the main point is, once you have a desktop for the day, you're able to reconnect in seconds right where you left off.
Right. And the tap and go is a proximity card that has a radio frequency. So you're using a reader along with a card. Is that something you can go into?
Yeah, that's correct. Yeah, there's typically proximity cards run on 2 different frequencies, like 125 kilohertz and 13.56, and there's different readers that are compatible with this type of solution, so that the users are able to use the existing badge technology that they may already have for their organization that gets them access to their building.
Right.
And so that way there's a single point of control, is that when that badge is deprovisioned, they're no longer able to access the desktop or access the building. And same thing with provisioning users. As the human resource department deploys out the badge, there could be a process that enables the users to gain access to the desktop.
Right. Okay.
So in this, the user connects to another desktop without logging in or tapping out from the prior desktop. And so an important thing is that different policies can be set based upon the location of the device. So you could have a different timeout policy for an in-room device versus at a nursing station or documentation station. So you can minimize the exposure to PHI when a workstation is unattended. To improve manageability and storage efficiency, the use of non-persistent pooled desktops is typically used. This means when a user logs off the virtual desktop, it's put back to its original state before another user logs into that desktop. For applications and user experience, there are files and registry settings that keep the user from having to repeat configuration tasks each time they log into a virtual desktop. The use of virtualization and personalization products allow defined settings like Internet Explorer favorites, shortcuts, email settings and signatures, custom spell check dictionaries, and other application preferences to be stored outside of the virtual machine to give the user a persistent desktop experience. Using user virtualization and personalization management tools, IT can set policies to create a desktop environment that will help reduce calls to the help desk, allowing customization for only what is required. Policies can be assigned to Active Directory groups to allow different levels of customization. For example, you could prevent the creation of desktop shortcuts except for physicians. So when we talk about moving from a shared kiosk desktop environment, we're looking at moving away from nightmares that can be evident in physician lounges or training rooms to a desktop with entitled applications for each user, a consistent look and feel regardless of what endpoint they connect from.
Nick, what I really like about this is where if a user does make changes with our policy management, we can reset that upon their day-in shift, so that workstation is not set up for the previous person's preferences. So that's a support, can be a support nightmare, and now it's blown away and reset back to that gold image.
Exactly. Some of the features that are inherent with VDI is that gold image, and I know Drew will be talking about it later in parts on security, but being able to have that pristine tested image and be able to roll it out on a scheduled basis, and also being able to fall back based upon if there is issues or bugs inside of that image, being able to roll back to a prior golden image is a huge advantage versus traditional PC deployments. And being able to roll out new policies, so as a user logs out for the day, then they come back the next shift, they could be getting their new desktop. So essentially, it's like turning on a switch. You could actually go from an XP look and feel to a Windows 7 look and feel overnight, and the access method to the user doesn't change. They still tap their badge, connect to their desktop, have their icons, but those settings can basically happen again with almost like a flip of a switch. So the transformation from device-centric to user-centric provides some changes in the way the desktop environments are supported and managed. Instead of managing some 60 devices on a med-surg unit, we look at the number of concurrent users, so really the staffing of the unit. Now we're supporting the user and not necessarily the device they're on. So we are enabling the integration of roles and groups in Active Directory to entitle application access versus exposing all applications on shared workstations. The IT resources are changed from a physical per seat to a per active concurrent model. Monitoring the health of VDI rollout is important, especially when right-sizing the environment as it scales out. Using the tool to help monitor user experience on such items as login times, concurrent connections, active usage per user. You can monitor how often they're actually connected to a desktop. Concurrent usage of applications, the average IOPS per user and average IOPS per application, and of course average CPU and memory usage. These metrics help determine the required resources needed moving forward as the environment changes with new applications and new processes. Patient context sharing technologies like CCAL and GSM allow applications to select the active patient consistently, reducing documentation errors and streamlining access to information. Enabling location awareness of the endpoints provides useful information that can optimize user experience and reduce the number of steps to carry out tasks. Location information can be used to prevent the access to applications, for example, prevent hospital employees accessing their email from inside of a patient room, or preventing print functionality from within an application when accessing from outside the hospital, allowing an ED application to only be ran from within devices inside of emergency room. So when looking at a VDI solution for healthcare, there is no one-size-fits-all. There are different types of users using different types of applications and accessing the information in different ways. The first step in our implementation methodology is an assessment, which we discover the current state and plan for future state. So we look for things like how are they currently accessing the information, what are the application and system requirements, named and current users, what types of devices they are using or plan to be using. A key is application dependency. So what are the third-party requirements? What's the workflow? So when you go from application to jumping to another application, making sure that that's documented so you can make sure that when you're building your golden image, you have the right components. Remote access. So how are they going to access? Do they have a current VPN strategy, or are they looking for a new way to connect from the outside? And, of course, analyzing how users are brought into the system and also offboarding of the users. Then we architect the technology to support the desired workflows by working with IT and clinical informatics teams. So we're using the information we gathered to build the solution and not having the hardware dictate a solution. Even though there are many specific variables with each project, we follow a methodology in all of our projects. From the original assessment to gather the current state, business priorities, and vision for future state to develop a project roadmap. And in the design phase, we architect the solution to find the sweet spot for the infrastructure resources. On to building the phase for the proof of concept to ensure the desired outcomes are technically achievable. Then we deploy a production pilot to a controlled unit or groups of users. And then with the feedback of the user experience and the performance monitoring tools, we make adjustments to the desktop environment and infrastructure and ensuring the right sizing to scale up or scale out. At this time, I'm going to turn the presentation over to Drew Fraser to discuss how security plays an important role in virtual desktop deployments.
Thanks, Nick. So as many of you probably already know, information security is a pretty broad topic. Today I'm essentially going to talk to you about some of the key factors that are impacts, if you would, in the context of virtualization. In the case that there's any interest to dive deeper into any of these pieces or to talk on a more broad scale with respect to security, I believe there's going to be a follow-up email after this presentation with our contact information, and feel free to reach out to us. So essentially, as you see with this image here, we look at security in terms of the way that we recognize, or the way that we deploy a VDI as this sort of holistic concept that surrounds the solution and integrates into the solution as well. As you heard from Nick, he talked about authentication management and also single sign-on, and we'll talk a little bit more about those types of solutions in detail here. But it's an all-in-one. It's part of the solution set, and so we certainly don't want to consider foregoing security in the context of virtualization because it's intrinsically part of it. So let me talk a little bit about that. So as we know through the architecture of virtualization, one of the benefits that we get out of it from a security standpoint is that our applications and data are never actually stored on our end device. They're literally encapsulated within some sort of protected server environment that's deep within the four walls of some hopefully protected data center. So the idea is that we're exposing a view of our applications and data to desktops and mobile computing platforms, and this intrinsically solves the problem of, again, storing that data on the physical device. And why is this a problem? Why am I even identifying this as a benefit in terms of the architecture? Is that for many of you that may or may not know, since the advent of high tech back in 2009, breaches with records over 500 patients in terms of impact have to be publicly recorded. And since 2009, we've had about 477 incidents that have occurred, totaling of about 20 million patients. Now, this is a big deal. The good news is that information, because it's being publicly promulgated on the Wall of Shame website with the HHS folks, we're able to take that information, perform some analysis on it, and learn some things about the industry. And one of the things that we learned was that essentially 70% of all of those incidents, including the number of incidents and the patients affected, were due to some kind of loss of or theft of a portable device. So by removing the data from the portable device, i.e. deploying architectures like virtualization, we help to mitigate that risk. So this is from an impact standpoint, impacts aren't always negative. This is a positive impact in the context of virtualization. But this doesn't mean that we shouldn't still concern ourselves with that virtual session, because there's still some risk there, and there's certainly still some risks with our endpoint computing platforms. Doesn't matter what they are, desktops, mobile devices, whatever it is that we're leveraging to access those environments. So what I'm going to talk about next here is sort of a bottom-up approach to define the security safeguards that we consider in the context of virtual desktop infrastructure deployments to mitigate some of the impacts that occur as a function of this sort of new phenomenon with respect to the virtual view of the encapsulation of information. So the first topic, which I'm sure many of you have probably heard about, mobile device management. This is a fairly hot topic today in healthcare because we have our clinical workers, namely physicians, that are starting to really drive on us from an IT perspective to become more efficient in terms of accessing their systems and to support a unified platform concept, which is basically bringing their own device into the workplace to also gain that access. So mobile device management helps us from a solution standpoint to start to solve some of the problems that it introduces from a mobile device standpoint. And there's really two schools or two paths of interest in this world to support this concept. One is the traditional mobile device management, which is essentially a sort of a centralized management or enterprise control of the device from a configuration standpoint, where with a single click of a button, an administrator can remotely administrate a pool of devices through this construct. So we can do things like control password policy, control password strength, define behaviors that are associated with access control challenges. So if we try the password too many times, we can lock, and it's failed, we can lock down the device, we can wipe the device. We can also leverage these tools to perform audits of equipment and also additional configuration functions that aren't necessarily aligned with information security, but more aligned with user experience in terms of the consistency of feel and efficiency of use. So that's the traditional definition of MDM. The sort of non-traditional, it's been around for some time now, but a new concept in the context of MDM is this idea of application sandboxing, where essentially we deploy the application to the device. And this, by the way, is more aligned with BYOD than, let's say, the MDM concept. The MDM concept works real well with enterprise solutions where I want to control the device holistically. We're not using it for personal use. It's only for business. I own the device from an enterprise standpoint. So this application sandboxing construct helps us take the enterprise and basically stick it into an app. So we deploy an app that's specific to the solution. Access to the app gives us access to the data. And then technically, the surrounding environment is not impacted. We can wipe the data from that app. We can encrypt the data in that app. We can control the password policies and very much some of the same stuff that we see in MDM with respect to that app. And that does pretty well. But in itself, there is still some risk with that solution. I was actually at Black Hat a few weeks back, and I had the pleasure of attending a very low-level discussion around mobile device hacking. And I learned that it's a very simple effort, should I be able to come upon the physical access of somebody's mobile device, to essentially go in the back door and leverage application faults to access some of these some applications that we would typically consider secure in banking and other types of industries, to access the data that application protects. This isn't necessarily a risk for virtualization per se, but clearly, in the wrong hands and with the wrong intentions, we could have some challenges there. So what the industry has done from a mobile device management standpoint is they've incorporated typically in those solutions a construct of both the traditional MDM deployment and the application sandboxing. So we have those both integrated together. So we're controlling the device and we're controlling the application, gives us sort of a dual-fold means in which to protect the endpoint. Now, there's a new emerging, I'd say it's new, probably about 18 months-ish old or so, concept around actually virtualizing sessions on the device. So essentially what we have is today is, we've gained lots of ground in mobile device technology in terms of processing power. So we can install hypervisor type technology at the OS level to create separations, delineations between personal sessions and business sessions, which has a lot of very good benefits. And the user, can, from an experience standpoint, it's very easy for them to toggle back and forth between these sessions. And essentially what happens is then I can bring my own device to the environment. I can switch back and forth from a personal standpoint. I don't have to worry about the enterprise essentially getting into my knickers in terms of what I'm doing or having access to the location of my device because it's mine. And then on the enterprise side, the enterprise has 100% control, similar to the MDM and the application combined model, with that particular session. So, and not only that, but from a user experience standpoint, we get a lot of benefit too, because we can create presentation constructs that are unique to each environment, which obviously lends itself fairly well from a use standpoint. So lots of advancements there, and certainly some things to consider in terms of access to a virtual environment from a mobile device. Another topic of consideration from an impact standpoint in the virtual space is antivirus. If anyone's been digging around in the VDI space today, I'm sure this has crossed your radar in some capacity. Essentially these sessions, even though they're in the data center and sitting behind a server and in a secured virtual environment, we still have risk from a malware perspective. And end users are using this tool, depending on how they're using this session, depending on how they're using it, we have exposure opportunities. So as Nick pointed out, one of the ways that we sort of traditionally do this in the virtual space, because up until just a few years ago, we really didn't have good solutions from a virtual standpoint in terms of antivirus, is we would use this concept called imaging, where we have this gold-billed image where on some sort of frequency, maybe it's once a week or once a month, we refresh that image in the VDI environment so that we can bring the user's desktop session back to a known state with no malware, hopefully. That's the idea. And this works pretty well, but it's not a comprehensive solution. It's got some gaps. Obviously, whatever the time is between when the user starts using the session and when the refresh occurs, any number of things can happen, including that session becoming some kind of a host for malicious software. So it doesn't get us away from having to find an appropriate solution and define appropriate strategy across our enterprise, including virtual sessions to support antivirus. So as we know, the off-the-shelf desktop solution for antivirus doesn't work. It's not designed optimally for virtual environments and can create major issues in terms of performance, and anyone who's experienced that knows this firsthand. So the good news is we have vendors that have products available today. They've been around for some time now that supports the idea of optimization in the virtual space. They support concepts like agentless integration, in which case they leverage the underlying infrastructure that's tied to the virtual environment to support security. So we have this intrinsic security function that we enable, and then also the concept of offline scanning. So we're not draining precious CPU and other types of resources from the virtual environment to perform the virus scanning. So we have means in which to support it. We certainly need to concern ourselves with it because it's still a risk in terms of security. And then we move on to data loss prevention. Now, this is not necessarily unique to virtualization. We have this problem everywhere in healthcare, and it's more so today, 2012, than it was, let's say, 12 years ago, because PHI is ubiquitous. It's everywhere within the environment. You know, it's in the cloud with HIEs. It's through the air now with Wi-Fi. It's basically everywhere on our network, and it's on mobile devices. And frankly, you know, you'd be pressed to answer the question, do you really know where your data is? Because most organizations don't. We perform, as I said before, or maybe I hadn't, but we conduct security risk analysis for many of our customers, and we learn a lot about many different organizations, and we try to use that information to help drive the industry towards greater security. But one of the questions that I always ask is, do you know where your data is? And typically, there's a position in terms of policy or practice that they understand where their data is. But in a very short order or quick review, we find out that the policy and practice doesn't necessarily line up with what we think is happening. So data loss prevention basically helps us solve that problem. And by the way, virtual servers and desktops are still at risk in this space. Granted, it's an encapsulated environment, but we still have data moving around in that environment that we need to keep tabs on. We need to control. We need to ensure that it doesn't move to a place that we don't want it to, like a portable device that would potentially walk out the door. So DLP solutions help us solve that problem. They help us discover the pieces of data that exist in our environment, categorize it, potentially even act on it, for instance, quarantine it in the case that it meets some sort of policy rule, and then ultimately work with existing infrastructure, including virtual technology, to basically constrict how that data behaves, where it moves, how the user can use that data. Do we encrypt it? Do we keep it in a certain location? Do we destroy it? What do we do? Well, DLP helps us do that, and it keeps us out of some of the challenges that we've seen as of late in terms of breach. At least it's one of the safeguards that helps us support that. So one other point I'll bring up with respect to DLP, because of the way that we architect virtual environments, the virtual environments can sometimes be encapsulated even from a network perspective. So we have a single bare metal box that's significant in size from a processing perspective, and it's got a great deal of instances on it, and data is moving around that instance, and potentially the data never moves into the traditional infrastructure that we have in the bare metal construct of the world. And so our traditional DLP solutions won't necessarily see that data. So essentially, we have an opportunity where the data could move around and we don't know about it. So DLP solutions that solve that problem are essentially instances that exist in the virtual space. And that helps us detect some of that virtual activity that we wouldn't see otherwise. And last but not least, we get into access control. And I shouldn't say not least because this is probably our biggest risk to virtualization, because as I described earlier, we have this concept of information encapsulation. And that works real well in the sense that we're not storing data on the endpoint. But we have to allow the user access to this environment, and if we don't do a good job in terms of managing that access, we're at risk. So why does that matter in terms of healthcare? Well, as everyone that's involved in healthcare knows, probably the majority of the folks that are on the call, we have some significant issues with respect to password management, specifically the strength of passwords and the policies that we leverage both from a technical standpoint to control passwords in the healthcare industry. A lot of weak passwords. In fact, I got a stat up there. This came from our aggregation of activity in the security risk space. A very small percentage of the customers that we work with leverage some sort of a strong, well, in terms of what we would normalize as a strong password from a security standpoint type of approach to protect our passwords. So we're weak there. And this is basically caused by a few challenges. We have shared workstations, as Nick talked about. Not a whole lot of space in the workplace. Lots of people needing to leverage machines, and not a lot of place to put machines, so we're sharing them. And we also have lots of applications that exist from a legacy standpoint that intrinsically don't have much in terms of password control. There's no strength, and there's certainly not a whole lot of policy constructs. So how do we solve that problem? So as Nick talked about, we have, I guess, what we can call the holy grail in terms of virtual solutions, and this is concept of enterprise single sign-on. This is not a new concept, and the good thing is it's not a utopic concept either. It's real, and essentially what happens is we can build single sign-on solutions to essentially solve all these problems. And I say we, I'm talking from an industry perspective. So we have issues in terms of user acceptance, where the physician doesn't want to remember 100 passwords, or if it's because they do, they put it on sticky notes, or they make them very simple, 3 characters or whatever, and there's no restrictions on that. So how do we protect against that? We incorporate solutions such as this. We incorporate the enterprise single sign-on solutions with VDI, and then we can get things such as a strong single credential set. So we have a badge and we have a PIN that is very easy to use, and it supports additional functionality like the tap and go function that Nick described, and we have great user acceptance. And then obviously from a single sign-on perspective, we can create some greater strength in terms of those passwords, as strong as we can make them, let's say, and the user never has to remember them because the single sign-on engine supports that. So it works real well overall in terms of managing sort of our biggest risk, that front door to this information encapsulation. So that pretty much covers what I intended to speak about today from an information security perspective. Obviously, there's a great deal more to discuss in this topic, including the reasons why we want to do this sort of thing. It's very likely that we'll have additional presentations on this subject in total. So when we send our follow-up email out to you, we'll provide you some information in terms of context. You can reach out to us directly and just look for us in the future in terms of talking more about information security. So with that being said, I'm going to turn it over to Jim so he can introduce our next speaker. Thank you.
Thank you, Drew. Certainly, security is broad and critical to everyone's success. Next up will be Craig Doyle. Craig is, as mentioned earlier, the Chief Information Officer at St. Tammany Parish Hospital, and he's going to discuss their VDI project goals and objectives and the experience and feedback. So next slide, please, and then we'll turn it over to Craig.
Good afternoon, everyone. Thanks so much for allowing me to join the conversation, and hope I can share our experiences and walk you through some of our great successes and some of it came pain. I think where I want to start with is just to let everybody know, we're a community-based health system and around the greater New Orleans area north. We're not unique to providing health care than any other institution with challenges of increased information security concerns. Technology is changing by the day. The user getting more intelligent on technology. Some users not getting up to the intelligence of technology. Multiple ID and passwords. I mean, just a list of things that are challenging for us that are really no different than anyone else. And so as we talk through the VDI strategy, I think, all the points that were made, I certainly would back up and say absolutely. But in the end, I think the theme for us, why did we go down this strategy, it was absolutely for the patient. And what I mean by that is as you give patient care to every room and treat the patient, it became more of a burden, technology interfering with that giving of patient care. And VDI as a technology and a philosophy, if you will, definitely eliminated some of those challenges and time it took to go to a new patient room, sign on to the application, get back to that patient's screen, bouncing around to all others. The computer dies. What happens? Things like that were real challenges. So, in the end, while everything else certainly brings added value, our prime goal, like, of course, anybody else in our industry, is how do we deliver better care for our patient? While the technology doesn't give better care, it certainly enables our caregivers that more time to the patient, and it certainly has done that. Some of the things I think are benefit for these calls when I'm sitting on the other end of this is, I like to hear some of the gotchas, some of the things that, maybe we didn't realize that kind of crept up on us, and, I'd like to share some of that with you. And as one of which is, it really brought to light for us how non-standard we really are. And what I mean by that is, yes, it's ideal and you live in a utopic world if you can get down to that one image across the board. However, in my opinion, that's unrealistic. But, how you get there and the small number of profiles or images is all based on how standard you are as an organization. And as we go through departments, units, and facilities, we came to the realization, wow, we're really not as standard as we really think we are. And it did bring more standardization that we didn't anticipate due to the technology. So, really understanding that helps you through. I think another part of it is thinking through everyone who goes through and gives care to that patient. And what I mean by that is we thought, hey, we can give this, we kind of phased it. We didn't do the big bang approach. You have to phase it. So we did a clinical nursing unit first and brought them up on, this technology and SSO. What we failed to pick up on is the other ancillary departments like dietary, case management, others that come in and, if you will, feed into that patient's care that we didn't think about, and they weren't able to sign on. So we had to quickly hurry up, educate, and train those, and that was a sidestep on our part. So think through everyone that touches the patient, not necessarily the device itself or the screen itself. I think another thing that was an interesting gotcha for us is the education of the audience. And what I mean by that is, VDI, SSO, Tap and Go, all three can independently be a project of its own. And all three you can deploy as independent projects. You could if you wanted to. But we chose to do all together. And giving that customer experience was a great asset. It kind of clouded what that technology brought to them. They thought it was all one and the same. And it really wasn't. And I constantly educated over and over. We're converting three technologies into one customer experience and bringing that better care of the workflow. And they started helping and understanding that, and it did make it easier to communicate after that fact. But education, in my opinion, was a gotcha. Another gotcha, and we're learning as we go now, is that customer service from my perspective of my team becomes different now because people calling in, we've got to understand what they're saying, and because we're not 100% deployed out yet. I would put us at the 50, 60 percentile, so we're in a hybrid model. Well, someone comes in, hey, I'm having issues with my machine. To them, they don't know the difference. It's a virtual machine versus a, if you will, a fat client where we're sending everything out. So that customer service and ready response to them, the dynamic changes on how they report it and how do we ask follow-up questions to get to the root cause and what is going on. So I think understanding that it was a gotcha for us. And it's a work in progress. And I can't say we're experts in it yet. And we're still struggling to understand those reporting comments and how does that translate. I think another gotcha for us was licensing and certification from all these application vendors in this technology. It's different. Some aren't as easy and clear cut. And not throwing any vendor under the bus, it's even probably more complicated. But understanding how that application license and certification plays a dynamic in this technology as well. Those are some of the big gotchas that kind of stuck out of my mind as I was preparing for my piece and conversation. But I want to leave my comments with good, and some of the good is some of the benefits we didn't think about, and now we're starting to explore the next steps. We've already touched on bring your own device. I think that's a future here, and I think bringing VDI into the picture makes that vision simpler to deploy. I use simpler, that's probably not very accurate, but it definitely helps along that path of bring your own device. I think it also helps us to better support telecommuting, where my organization at least was always challenged on how to support that fundamental telecommuter as our industry changes, as our support staff changes. How do you support those telecommuters? This technology certainly has helped us and has done wonders for us in that telecommuting space. And we're starting to really understand the benefits of the usage and trending reports. Everyone, in the healthcare, you don't have enough PCs, you don't have enough this, that. Well, we're starting now to report on those areas of where we've penetrated VDI and have come back with not understanding the concern as we're seeing you have X number in this vicinity unit, but you're only really using 40% of the time with those units because you can better track. So I think that was really, really good exercise for us. We are still going down and learning more. Certainly no experts in the space, but every day that goes by, we feel more and more confident this was the direction as an organization we needed to go in, and we're happy we did go in. And with that, if someone would click to the next screen for me. This next screen kind of embodies what everybody at the end of the day really feels like our win was. And that win was they didn't know how we worked without it. The challenge for us as a project in its totality is I hate to use this analogy, but now it's like crack. They can't get enough. And we know immediately if something's wrong. And now everyone else that doesn't have SSO is now jockeying with me who can be next and how fast can you get it out. And it really is, if I could, bring it all out as faster, we would, because it's that beneficial. But it is a methodical, stick to your plan, be diligent, and I would advise on all those things. But, that for my CNO, that definitely embodies the technology we brought out and the benefits that it can bring to it. And that's really all I have, unless anybody has any questions or if we're saving questions for later. I'd be more than happy to answer anything.
Craig, I think we're gonna wrap it up, and then we'll go into some questions. But I would certainly, I want to thank you because you brought a customer's perspective to the table, which is tremendous. And at the end of the day, we're not here for technology. We're here to provide more time for the caregiver. And I think the slide from Carrie was tremendous. And again, your experience, both the challenges and the benefits were fantastic. I think you added a lot to the presentation. In review, I just state VDI by itself is not a total solution. So what we've done is we've taken that VDI and we've combined it with other components and the knowledge and the skills to call it an overall solution. So, we talked about some of the components and security and implementation methodology. So, moving on to the next slide, what we've done is we've taken those components and instead of calling it VDI, which was really kind of a struggle, it's not VDI, it's all of the components together, and we call that SORI Information Access. So, it's a new branding that we've had. Craig, at the time when we were implementing with you, it was not known as SORI Information Access. It was kind of VDI plus SSO and plus these other things. But we now call it SORI Information Access. So it takes all of those technologies, tools, and components and wraps them together in a packaging that meets the needs. And hopefully at the end of the day, we're giving more time back to the caregivers so they can deliver care and not practice technology. So at this time, Charlene, I believe that was our last slide.
Thank you very much, and thank you, Jim, Nick, Andrew, and Craig, for a very informative presentation. We do have a number of questions from the audience already, and I just want to remind the audience, please click on the red Q&A widget at the bottom of your player console to submit a question. We'll try to get to as many questions as possible because, as you can see, we're kind of running tight on time, but we are going to go over. If we don't get to your questions, the team will contact you and follow up and answer your question specifically. So if you have asked a question, we will get you the answer. If not today, then within a very short period of time. Craig, a couple of questions for you, and the first one was, what software vendors deliver your VDI solution? That is it Imprivata, Citrix, or VMware?
We use Imprivata as well as VMware. VMware obviously being the virtual desktop platform, and Imprivata for our SSO solutions. And it really has done us well. Quite pleased with it. Getting to that decision, I will readily admit I'm new to the organization, about 7-8 months into my tenure here, so the decision-making process I wasn't a part of. However, in retrospect, hearing of knowing the challenges, understanding the players, understanding the technology, it was certainly the right choice for our organization.
So you came in on a huge project, didn't you?
Oh yeah. Not one install took place day one when I was here, so it just got dumped in my lap.
Wow.
But I have experience in my previous, so it's not foreign to me.
Well, CIOs have to be flexible, first of all, so you've just demonstrated that. The other question was, and I think this is a good one, does your disaster recovery plan or business continuity plan, does it provide coverage for VDI? How do you deal with that?
Wow, if any area of the country really needs a disaster recovery plan based on a few years ago with Hurricane Katrina, it's certainly in the back of our minds. And yes, that does play a big part of our disaster recovery and business continuity plan. While we are still in that hybrid model, that is definitely our go forward. And when I touched on telecommuting or in remote users, we have a handful of people doing that now, which will enable us. That's how we're doing it for that business continuity disaster planning, because we can easily turn up multiple users off-site who are predominantly on-site. We can easily turn them up if something were to happen. Absolutely essential to our disaster recovery and business continuity procedures.
Thank you, Craig. The next question is for Nick, and the question is, if you already have Citrix, why move to VDI?
And that's a good question, and we do get that a lot during the initial assessments. And like I talked about, the vendor relationships and the IT skill sets of each individual hospital are a big player in deciding which vendor to use, whether it's Citrix, VMware, Microsoft, and others. There's VDI by itself, by definition, is a full OS per user, so it's a full desktop OS versus Citrix with their FlexCast has other ways to deliver a virtual desktop environment that's not necessarily a Windows desktop OS, but maybe a server-based computing. And so what we talked about today is more about what surrounds that virtual desktop, whether it's VDI or SBC, and all those advantages we talked about can also incorporate into the different types of virtualization. So I think it's more about a workflow. So I think if you have Citrix or VMware and you're happy with it, it's more about the experience and your vendor relationships.
Thank you. One question goes back to the proximity cards. You mentioned that you had two different ones running on two different bandwidths. Are there any instances of interference with any of the other wireless devices within the enterprise?
Typically, no. They're passive RF frequency, so you have to be within like an inch of the card. So they're not an active RF tag like a I guess a location based thing if you're trying to track like an IV pump that has a battery. So the cards typically don't cause interference.
Excellent. And that's all the time we have for questions today. I want to make sure that you know who we are. For more information about upcoming healthcare informatics webinars, be sure to visit us at www.healthcare-informatics.com and click on the webinars link. The information should be on your screen, but I don't think it is it? Also, feel free to join our online communities on Facebook and LinkedIn to share and participate in the discussion with the healthcare informatics community. This program will be archived for 1 year for your convenience and for sharing with colleagues. Within the next 24 hours, you will receive an email notifying you of the archive's availability and with a link that will provide you with access to this archived recording. Again, I'd like to thank Jim Kaler, Nick Volleson, Andrew Frazier, and Craig Doyle for a great presentation. And I'd also like to thank Siemens for making today's program possible. Finally, thank you to those of you in our audience. We hope you'll join us in the future for another Healthcare Informatics webinar. This concludes today's presentation.